Welcome to our introductory dive program. During this program, we cover some important information about scuba diving, so please watch and listen carefully. At the end of the program, there will be an instructor available to answer any questions you may have. You will be guided through your dive by one of our qualified dive team, and at the end of this experience, you will receive a certificate. This is not a qualification, but simply recognition of your achievement. Diving is a fun and reasonably safe way to experience the Great Barrier Reef, provided a few important rules are followed. Water has weight and therefore exerts pressure. As you dive deeper, the pressure increases. Your body is mostly water, so it won't be affected by the increase in pressure as you descend. However, air spaces in your body are affected and will be compressed by the increase in water pressure as you dive deeper. This is similar to the pressure changes you feel in your ears and sinuses when landing in an aeroplane. Air spaces are affected by changes in pressure as you descend on your dive. These include your ears, your sinuses, your lungs, and the airspace created by your mask sitting on your face. The first change you will notice during your dive is an increase in pressure in your ears and sinuses. To avoid discomfort and possible ear damage, you will need to equalize pressure in your ears and sinuses as you descend on your dive. To equalize your ears and sinuses, pinch your nose and blow gently against your blocked nostrils. You need to equalize pressure in your ears early and often, about every half metre as you descend. Practice before your dive by pinching your nose and blowing gently against your blocked nostrils. Having a cold or congestion makes equalization difficult or impossible. If you have a cold or are congested for any reason, you should not be diving. If you feel any discomfort in your ears and sinuses during descent, stop and signal to your instructor. Your instructor will ask you to ascend a short distance and try again. To minimize the possibility of a serious ear injury, never equalize forcefully or for a long time. After a couple of attempts, if you still can't equalize your ears, the safest option is to let your instructor know so you can then abort the dive. You will also need to equalize your mask during descent. Just blow air out of your nose into your mask to achieve this. There isn't any need to equalize your mask or ears as you ascend because air releases on its own. The lungs are your most important air space. If you hold your breath, you trap air in your lungs. If you swim up while holding your breath, the trapped air in your lungs expands and stretches your lungs. The lungs aren't meant to overstretch, so this can lead to serious lung overexpansion injuries, including death. The good news is that equalizing your lungs is very easy. Just breathe continuously and never hold your breath. This is the most important rule in scuba diving. Breathing continuously during your dive will prevent a serious lung injury. To recap the two major rules: 1. Equalize early and often as you descend, and do not continue down if you have discomfort in your ears. 2. Breathe continuously and never hold your breath. Once you're underwater, interacting with marine life is the best part of diving. Most marine life is harmless, however corals are sharp and easily broken. Please be careful not to damage the corals during your dive. Talking is impossible underwater, so we use hand signals to communicate. The most commonly used signal is the OK sign. This is both a question and answer, so if your instructor gives you an OK sign, please give an answer. If everything is OK, respond with an OK sign. If there is a problem, use this signal and then indicate the problem by pointing. For example, if you have discomfort in your ears, indicate you have a problem and then point to your ear. Your instructor will then take the appropriate action to assist you. Some other useful signals are go up, go down, and stop, in which case you should stop moving. Your instructor may also ask you to slow down or take it easy. Your instructor will check your air gauge regularly during your dive and will indicate by showing you his air gauge. Air gauges have a red low on air section which indicates you should be heading back to the surface with your instructor and finishing the dive. It is extremely unlikely to run out of air during a dive, but if you do, indicate you are out of air by slashing your hand across your throat. The first item is a mask. Please let us know if you wear glasses, as we have special masks with prescription lenses to help you see underwater. Before you get into the water, you need to prevent your mask from fogging. Spit works well, so spit into the mask, wipe it around the inside of the lens, and then rinse it out. To fit your mask, place it on your face and pull the strap back until it is sitting just above your ears. Your instructor will check to make sure your mask is a comfortable fit and in the correct position before you dive. You will also need fins for your feet. Make sure the fins you choose are a comfortable fit. To use your fins correctly, keep your hands by your side, kick from the hips down, and use slow, steady kicks. Depending on the water temperature, you may also be fitted with a wetsuit and a weight belt before your dive. Once you have your scuba equipment in place, you will then practice some skills that will help you feel more comfortable underwater. The first skill is clearing water out of your mask. If you do get water in your mask, simply press in at the top of the frame, look up slightly, and blow air out of your nose into the mask. This will force water out the bottom, clearing your mask for you. Remember to press in, not up, on the frame, as this will allow more water to enter the mask. So mask clearing is 3 easy steps. Press in, look up, and blow through your nose. The most important part of your scuba equipment is the regulator. Place it in your mouth and bite down gently on the 2 lugs. To breathe correctly, push your lips forward and breathe from the back of your throat. Breathing underwater for the first time can feel a little strange, so give yourself a few minutes to get comfortable. Losing your regulator out of your mouth is very unlikely. However, there may be circumstances that require you to breathe off another regulator other than your own. For this reason, you need to learn how to remove and replace a regulator. First, hold the regulator in your right hand. After taking a breath of air, remove the regulator from your mouth. Remember, you must not hold your breath, so while the regulator is out of your mouth, breathe out a continuous flow of small bubbles. This keeps your airway open and prevents a lung overexpansion injury. Place the regulator back in your mouth and blow air into the mouthpiece before breathing in. This will clear water out of the regulator, enabling you to continue breathing. Let's try again. Breathe in, remove the regulator, blow out small bubbles, replace the regulator and blow out. You will also notice that you have a second regulator. This is called an alternate air source. It is there for an out-of-air situation only. Should you need to use an alternate air source, your instructor will pass his to you. To practice an out-of-air situation, first remove your own regulator and signal you are out of air. Don't forget to exhale small bubbles, then place the alternate air source into your mouth. Clear the alternate air source by blowing out, and don't forget to take a careful first breath in case there is still a bit of water left in your regulator. It is extremely unlikely that you will need to do this during your dive, as we continually monitor your air supply. To assist us to do these skills, we use some additional hand signals. The first of these is "You watch me." This means your instructor will demonstrate the skill for you, so please watch carefully. After watching the demonstration, your instructor will indicate for you to try. The last alternative, if you are out of air, is to swim to the surface. This is very unlikely to occur, but if it did, you would keep your regulator in your mouth and swim to the surface, making an "ah" sound as you swim. This keeps your airway open and prevents a lung overexpansion injury. Once you are on the surface, you can inflate your jacket by pushing this blue button. The air in your jacket will give you enough buoyancy to float comfortably. Inflating your jacket underwater can be dangerous if done incorrectly, so your instructor will do this for you. Your instructor is highly qualified and ready to assist you above and below the water. The following are the main points to remember, but please ask your instructor if there is any part of this presentation you do not understand. Breathe continuously and never hold your breath. Clear your ears every half a metre and don't dive if they won't clear. If there is anything you didn't understand during this presentation, please ask your instructor. Enjoy your dive.